The 3M surgical clipper with pivoting head, model 9661 with the option of the pivoting blade or the 3M Premium 40 disposable blade, make complying with the preferred method of hair removal easy and efficient. The 9661 surgical clipper is the only 3M clipper handle that can be used with two blades, allowing for personal or physician preference in hair removal. Let's take a look at the benefits of this surgical clipper. The pivoting blade assembly conforms to body contours, especially in difficult areas such as body folds or creases. The disposable single-use blades can be used to clip fine to coarse, dry or wet head and body hair. The clipper can be used in either a push or pull motion, allowing user comfort and ease of use. The cutting blade is on top, away from the patient's skin, to reduce the risk of nicks, cuts, or abrasions. The clipper is battery operated, so it can be used wherever clipping is required. It has a nickel metal hydride battery, the battery of choice for environmental disposal. The clipper can be cleaned by wiping with a disinfectant like isopropyl alcohol or rinsing under water. Because both the blade and blade attachment design does not promote hair retention, submersion is not necessary. Before we demonstrate clipping technique, let's review the components of the 3M surgical clipper with pivoting head. The charging stand, which may be secured to a counter with its mounting screws or placed in the wall bracket. The clipper handle with its easy-to-reach on-off switch, and single-use blades designed to promote infection control by reducing the risk of cross-contamination. Before first-time use, the 9661 surgical clipper must be charged for 18 to 24 hours. After the initial charge, a 90 to 100-minute run time is achieved with a 12 to 14-hour recharge. This is the longest battery operation time of any surgical clipper currently available on the market. And the nickel metal hydride battery is memory-free, so there is no risk of overcharging. To make sure the clipper is correctly placed in the charge stand, be sure the yellow charging light is lit. If the clipper is in the charging stand and the yellow light is not on, gently adjust the handle position until the light is illuminated. If adjusting the clipper handle doesn't affect the light, check the wall connection. If the cord is secure in the wall receptacle, clean the electrical contacts at the base of the clipper. The 3M surgical clipper with pivoting head is designed to be comfortable in your hand. It can be held like a pencil or with your fingers on top, whichever is most comfortable for you. This clipper is appropriate for all types of hair. For best results and expedient clipping, it's best to clip against the growth of the hair. The techniques demonstrated work with either dry or wet hair. Now you're ready to begin clipping. The pivoting head feature is unique to this clipper. It allows you to adjust the blade for either a pushing or pulling motion when you clip. To clip using the push technique, position the blade at a 15 to 30 degree angle to the skin surface. Gently push the clipper forward across the patient's skin, clipping against the growth of the hair. Use gentle strokes and apply very little pressure as you let the clipper do the work. 1 to 2 millimeters of hair stubble is left above the skin. If using the pull technique, simply rotate the blade on the pivoting head 180 degrees and position the blade at a 15 to 30 degree angle to the skin surface. Gently pull the clipper across the patient's skin. A raking technique should not be used. The raking technique negates the safety feature of the stationary bottom blade and increases the risk of skin damage. On difficult areas like the groin or around skin folds, make sure the skin is as dry as possible. Flatten the skin and gently stretch it with one hand while you follow with the clipper in your other hand. Elderly skin can be especially thin and more susceptible to damage, so remember that light, gentle strokes are all you need. Care should be taken not to stretch, scrape, or apply excessive pressure to delicate skin. To reach a difficult angle, at any time, you may lift the clipper off the skin and conveniently turn the blade on the pivoting head. This allows you to maintain excellent visibility of the blade. When removing head or scalp hair, the Premium 40 9690 blade provides the best performance. With a cutting width of 40 millimeters, the Premium 40 blade moves through wet or dry hair with ease. The upper cutting blade minimizes the risk of skin trauma. Intact skin helps prevent migration of normal skin bacteria into the body, thus reducing the risk of surgical site infection. Before beginning hair removal, inspect for skin imperfections and visualize the surface to be removed. With either blade, begin at the hair-skin margin or at parted hair. Use slow, deliberate strokes and remove hair from the blade path as it is being cut. After long strands have been removed, touch up if needed to ensure uniform stubble length, approximately half a millimeter with the 9690 Premium 40 blade and 1 to 2 millimeters with the 9660 pivoting blade. When you're done clipping, slide the switch to the off position. There will most likely be clipped hair left around the site. It can be wiped away from the patient with a towel. Clipped hair remaining on the body can be removed with a non-aggressive adhesive tape such as 3M Transport surgical tape. To help prevent cross-contamination between patients, remove and discard the used clipper blade. The clipper handle should be cleaned before you return it to the charger stand. With the clipper switch in the off position and the blade already removed, wipe the clipper handle with an alcohol wipe or a cloth dampened with a disinfectant solution. Or rinse the clipper handle under running water or disinfectant solution. If a disinfectant solution is used, rinse with clean tap water. There is no need to immerse the clipper body because the blade and blade attachment design does not promote retention of hair. Whichever method of cleaning you choose, dry the clipper thoroughly. Then return it to its charging stand. The switch should still be in the off position. While you get used to using and charging your clipper, refer to the user's guide as needed. The 3M helpline is also available if you have questions, or contact your 3M sales representative for assistance. The 3M surgical clipper with pivot head 9661 carries a 1-year warranty, the most extensive in the industry. It's just one of many reliable infection prevention products offered by 3M Healthcare, and they're all backed with the quality service and support you've come to expect from 3M.